Tuberculosis, or TB, is a bacterial disease that is quite infectious, that affects the lungs and sometimes other parts of the body. TB is highly contagious and can spread through the air. There are some treatments, but it can take a long time for someone to rid their body of it. Today, on this World Tuberculosis Day, we're raising awareness about the disease. Joining us now is Dr. Rachel Dwilow, a pediatric infectious disease physician at the University of Manitoba. Good morning, doctor.
Good morning. Thanks so much.
Well, thanks for joining us. Now, tuberculosis, it's been around for a long time, affecting humans. What is it exactly?
Yeah, that's a great question. It's extremely common, and I think the general population out there, friends and relatives of mine, aren't even aware this still exists in Canada. 11 million people every year in the globe are diagnosed with TB, including 1.3 million children. So I think it's a great thing to talk about. It's basically a chronic lung infection that mimics other types of lung infections we see more regularly, but the treatment is very different. It's different drugs, and often people, unfortunately, as it becomes less common in certain countries, don't get the right treatment right away and continue to suffer.
Okay, and it could be deadly.
Yeah, absolutely. Without treatment, it's fatal, essentially.
Okay, and then it's also highly contagious, right? Tell us how it spreads.
Yeah, exactly. So really, I would say most people, the big thing is you have to be around somebody with tuberculosis or TB in order to catch it. And I would say in Canada, there's two population groups that are at increased risk. So people that have spent time in countries where there's more TB, which generally is outside of North America and Europe. Okay. Very common, or unfortunately in our Indigenous folks. And so you have to be around someone to get TB in order to catch it, and it spreads through the air, unfortunately.
And what are the symptoms?
Right, so unlike some other infections that cause chronic cough, TB is a much slower onset and a much slower progression of symptoms. So if we think like COVID or the flu, for example, really sharp onset, get really sick. TB is not like that. It's slowly over weeks, I would say, to months rather than a day.
So that people don't even realize they have it and maybe infected a bunch of people before discovering it.
Absolutely, and that's exactly what happens. People don't realize they're sick with TB until they're very, very sick and present to care like extremely unwell. So,
and we have a high number here in this province. Why is that?
You know, I think unfortunately, we have the statistic, if we look at our public health data that's available online, of having the highest rates amongst any province in Canada. But again, there's a lot of reasons for it. Anywhere in the world, TB is about access to care, access to good housing, and access to nutrition and good drugs. And those are some of the same things in our populations here that we see. Okay,
so what can you do to protect yourself?
Yeah, so I think, again, obviously, if you're coughing for longer than 2 weeks, losing weight, and you're someone, again, from a community, and most communities that are affected by TB are aware. Okay. You need to go get checked and, obviously raise your concerns. And again, if you cough, you get antibiotics and it doesn't go away after 2 weeks, you just need to get checked again until things get better.
And this is also something that is a concern for children.
Absolutely, and that's actually my specialty too. I treat children with TB, and a lot of people wouldn't know that we need a TB clinic here in Winnipeg and Manitoba. But unfortunately we do. Children, it's different. And the issue with children becomes that unlike adults, they're more likely to have forms of TB that are more deadly. So TB in the brain, TB in the bloodstream, and TB in other organs. And so that's what I deal with quite a bit.
Okay. Well, thank you for raising some awareness with us this morning. And if you do want more information, we have a link on our website. Thank you, doctor.
Thanks so much.